So while I'm putting this on, can I ask by show of hands, like who's a new grad? Okay, and then who's like 1 year or so, 1 year to 2 years experience? Really? 2 to 3? 2 to 3, 4 to 5? 4 to 5.
They're not all nurses though.
Right, and then but any experience, and then other experience here. I know I have transport here. What other departments are here? Is there radiology? No. I'm trying to think of ones that I like to talk about. But we have like you have PCU here, right? We have PCU. We have 3 North. We have 3 Tower. Okay, very good. So you have the very widespread of like use cases for all the equipment here. So the goal today for the next 2 hours help show you guys, familiarize you guys with these pieces of equipment that we've deployed throughout the hospital back in 2019. It's available everywhere in the hospital, which is different from in the past where you could only find this in maybe 1 or 2 designated places. It made it very hard to use, and very few people knew how to use it, and it made it more dangerous to use. So today you're going to find when you look at your handout that these things are actually on every floor. So you can look for your floor, and you should expect to find all of this equipment there. Usually the little textile pieces over there are in a little drawer or a little cabinet somewhere. You'll just have to do a little bit of digging. But again, my name is Jerome. That's Debbie, and we're going to get you started with the least complicated piece of equipment all the way over here. This is the Sarah Steady. This is a new version of the Sarah Steady. It carries up to a 400-pound patient. It has legs that can move to accommodate for different sized chairs, and this is a good piece of equipment for a kind of patient that follows commands well, who has good upper body stability, and can, for the most part, you expect them to stand up well because they have good strength on both sides. So you come across your patients that have weakness on one side due to some kind of diagnosis, usually a stroke. You wouldn't want to choose this. Again, for the nurses here, it's you guys to determine for yourself if you feel like the kind of patient that you want to put in here is going to be appropriate. And I think to start with, 400 pounds. And second thing, make sure they follow commands. Make sure they have good upper body strength. And I like this thing so much because whenever the physical therapy department is like at the end of their shift and it's like a Friday and your patient really wants to get out of bed or else, this is a good way to get your comment card. When they say, oh, they were so amazing, they were so amazing. This is the way most nurses have come across that. For ER, and is there any ER here at all? No, ER. You are allowed to use this in the parking lot to get a patient out of their car and into the ER. Otherwise, it's not to be used as transport at all. And when we clean it, you just use your purple wipes. But I'm going to start with the demo. I know, Kayla, you and I talked earlier about we're going to demonstrate this. So, Kayla, if you could come on up, I'll give you this chair. You want to sit right there for me? Thank you, Kayla. All right, guys. So the way this starts out is you open up the side chair so that there's a way for you to actually get into this, okay? So you've never seen this before, so I'm going to tell you, this is a Sarah Steady, okay? What I'm going to have you do, I'm going to bring it towards you, and you're going to lift up your feet and put it onto the platform down there, okay? Very good. All right? And now I'm going to lock the wheels, all right? And I'm going to want you to hold on to this like bicycle, like a handlebar of the bicycle. Go ahead and hold on to that. Very good. Okay, now everything is locked. I'm going to have you stand straight up, okay? Very good. I'm going to put the chair behind you. Now go ahead and sit down on that. And then let your knees come up against the knee pad there. Cool? And that's how yeah, that's good. This is how we give report. I'm just kidding. As you can see, you can push a patient around. This is on carpet. Melissa, right?
Yes.
Can you come on up? And I actually want you to try and just push Kayla around a little bit so you can get a sense of how that works. You can use your, you can have a little handle right there to push on. Actually, the way you would use it, like over here, like if you come over here, like you would hold it like this and like that. Push it around. There you go.
This is fun.
Yeah, it's pretty good. So Melissa, I'm gonna help you put her back into the chair,
Okay.
okay? So let's just go ahead and position her over the chair. So you can imagine like using the toilet, washing your hands after you use the toilet, that kind of thing. Go ahead and lock the wheels. Great, thank you. And real quick, before she stands up, you can actually assess her back. You can assess the back of her heels. So this is a good way to get your skin assessment done without bothering the patient too much. They wanted to get up anyhow, right? All right. Can we go ahead and stand up for me? And then Melissa, let me take that out with this. All right, slowly come back up. That's it. Thank you, Caleb. Thank you, thank you. Good. Okay. I'll park this for you. And then, any questions about this? Easy, right? Okay, it gets harder. Okay. All right, Debbie, you'll be taking over.